Welcome back. Big tech continues to move into healthcare. It is raising fresh privacy concerns, though. Lauren Simonetti with all the details on that. Lauren, good morning.
Good morning. The next frontier for big tech is your health. You might be scared by this. You might appreciate what they're doing. Let me explain. So Amazon is using algorithms to sell software that mines through your health data, your medical records. Why are they doing this? Well, they want to make money. Healthcare is a $3.2 trillion market. They are a business, but they also want to save money. They want to cut costs. They want to prescribe you right the first time. And when you're looking at something like cancer, Amazon is saying in their press release announcing this, you know, hours can become seconds when you have software and algorithms and the right technology that can go through all that unstructured medical text and really save a person when you do have certain diseases. The limiting resource is time. So that's where they can come in and help. It's also great for experimental drugs and getting, you know, the right patients in the right drug trials. Amazon is not the only company getting into healthcare. Here's Toby Cosgrove, as he spoke to you a little while ago, Maria.
You are now an advisor to Google.
Yes.
That in and of itself, I think, is so great that Google is spending the resources on healthcare expertise.
You know, I think we're seeing increasing interest amongst the high-tech companies around healthcare, whether it be Apple with their watches and whether it be Microsoft for the things that they're doing, or Amazon and Google as well. Interestingly, we're having an explosion in healthcare, which is, one, a problem, and B, an opportunity. The problem is that the total amount of knowledge in healthcare is doubling every 73 days.
That's an incredible stat.
Probably going to have to go to the cloud for people to manage all this data.
That becomes the opportunity. So all of this data being forced onto the cloud gives you an opportunity to apply machine learning.
Exactly. Well, on top of that, it also gives you interoperability.
So can you trust tech with keeping your data safe, with going through your data in the first place, with not getting hacked? So this is the way we're moving. You know, you go to the doctor now, the doctor doesn't come out with a clipboard. It comes out with a laptop or an iPad. You see it all the time. We're there. Do we trust algorithms?
One thing that Toby also said that day when he joined us, Dagan, was that there are things like a mobile stroke unit. So a person has a stroke and they are picked up in the ambulance, and right there in this vehicle, they can perform many of the things. And, you know, when it comes to strokes, the sooner you get to the person, the more important. So you can actually perform this, you know, procedures and whatever it takes in the vehicle. It's called the mobile stroke unit. So some of these technology breakthroughs that we're seeing are really life-saving. It's putting the data privacy issues aside, but that is also an issue. I recognize that.
My mother had a stroke, a cancer-related stroke, and the person that she went to see for it missed it. She was stroking for about 5 days. So again, whatever it takes for these doctors and even the patients to make better decisions about their own health, even just the management of the drugs that you're taking. With my mom having stage 4 metastatic lung cancer, it's very difficult to manage all of the drugs that she has to take. Very often the sheets that they print out when you get to the hospital, there's redundancy. There are drugs on there that she stopped taking 4 years ago. Anything to improve patient outcomes, to manage the process of caring for particularly a catastrophic illness. And why do we always ask the question, do you trust these big tech companies with the data? Why do we trust the government, Governor? Because, again, they control all of this Medicare data, vast amounts of health information. Why do we trust the government over big companies?
Who says we trust them? I don't trust any of them. I don't
That's
trust
why
the government.
I said that.
I don't trust the big tech companies. But I think we have to accept the fact that we're no longer living in the day of Marcus Welby and the little black bag that he comes over to our homes and he sits down and puts the stethoscope up to our chest and listens to us. Those days are gone, and probably we're way, way better off because they are.
Exactly. So while there are risks in terms of privacy and hacking into your medical information, do we agree that the positives as a result of the marriage of technology and healthcare outweigh it?
In terms of the security of it, not the manipulation, but I would trust Amazon and a big tech company. Your information is already digitized and out there, and it's in the hands of of companies that are not, their primary business isn't protecting digital information. So I would say that at least Amazon and an Apple might have a better idea of how to protect that information than, say, I don't know, a lab testing corporation.
Yeah,
like that sends you the bill with all
gets it wrong.
That sends you a bill in the mail to the wrong address that has a list of all the tests and biopsies that have been performed on you in the last year. That to me is dangerous, not Amazon basically trying to improve the patient experience and outcomes.
All right, we will leave it there. That's amazing that data is doubling every 73 days in healthcare. Lauren, thanks. Lauren Simonetti.